Today's press conference is being held virtually in partnership with Commonwealth Media Services. This press conference is being recorded. For all participants, you will be muted upon entry. Please turn off your video for the duration of the event. We are joined by Acting Secretary of Education, Noe Ortega, Deputy Secretary of the Office of Elementary and Secondary Education, Matt Stem. And now I will turn things over to Acting Secretary of Education, Noe Ortega, for some opening remarks.
Thank you, Kendall, and welcome to the PDE team. Good morning, and thank you everyone for joining us today. I'd like to take a few minutes to begin today by recognizing our students, educators, school staff, and other personnel, families, and school communities for the tremendous work that they've done over the course of the past 9 months during the pandemic. No doubt, these are unprecedented times that have presented our school communities with some challenges that many of them have begun to adapt to and overcome. I'd like to just applaud everyone for responding commendably and really thank our teachers for your willingness to adapt your instructions for the purposes of learning and continuity of learning for our students. For our food service staff, I want to thank you for your willingness to repurpose some of the operations to ensure the provision of healthy meals to our students and families, to our school nurses, building leaders, our bus drivers, everyone doing the best they can to ensure that students and families have access to the tools, resources, and support needed during the pandemic. And to our partners, some of which include some of the public television stations who have collaborated and coordinated on programming and resources that our educators can use to support. This community has illustrated tremendous resolve, flexibility, and courage during a time which has presented us with a number of challenges. No doubt, there has been some challenges with regards to provision of instruction to folks that we have as a department challenged ourselves to work with our school communities to overcome. But it'd be unfair if I didn't acknowledge the inequities that it persists throughout the Commonwealth during the pandemic that we work hard to try to resolve with our school partners. The administration and the Department of Education have been working with the Department of Health around mitigation and containment efforts and continue to do so. We have long held a roadmap in place to ensure the continuity of learning for all our schools in the Commonwealth. Remember, I'd like to remind everyone as we go in this, Pennsylvania schools continue to operate and we continue to provide resources, guidance, and recommendations to our school for the provision of in-person instruction. While we have made guidance recommendations, we recognize that there is no one-size-fits-all policy for the Commonwealth. That's why our efforts to mitigate the transmission of COVID-19 have often been segmented, they've been targeted at times, and they've been adjusted to account for emerging research and findings as these continue to come our way. But as we've been reminded in the last few months, our mitigation efforts and strategies are often influenced by changing levels of transmission. In the recent resurgence that we've seen throughout the past couple of months, we've once again had to adjust, pivot, and ensure that we can continue to put recommendations and efforts out there that allow for our schools to remain safe for learning. Hence the announcement from Governor Wolf and Secretary Levine most recently on limited time mitigation efforts. So we are here today as the Department of Education to help answer any questions that you may have about the orders and some of the mitigation strategies. I'm joined by my colleague, Matt Stem, the Deputy Secretary for the Office of Elementary and Secondary Education, who also looks forward to answering some of the questions you may have as well for us today. Thank you for allowing me to make a few opening remarks. I'll now turn it over back to Kendall Alexander so we can begin with some of the questions.
Thank you, Secretary. We will now open for questions and we'll call on reporters in the order we received RSVPs. For time purposes, please be brief. Our first reporter is Jan Murphy with the Harrisburg Patriot News. Go ahead and unmute.
Hi, Secretary, can you hear me? Can you hear me?
We can hear you.
Okay, great. So we've been hearing from several school districts, and so I was just wondering, can we trust school districts who seem to see leeway in interpreting the state's guidelines on reporting of COVID cases and complying with the guidelines. Is there any audit that the state is doing or planning to do to check on their compliance with the guidelines? And aside from the Department of Health form that says, you're supposed to direct your complaints to school leaders, do you think that that is the best way to handle it for parents or educators who fear retribution if they speak out?
Sure, Jen. And so I'll handle your question in two parts, and I'll invite Matt Stem as well to provide some information with regards to some of the response efforts that we've been organizing as a team. So the department continues to work with the school community and a number of stakeholders to ensure that, I'm sorry, can you hear me? I hear some background
Please mute
noise.
your mics.
Thank you. So the department continues to work with our school communities along with a number of stakeholders to build the trust so we could collectively begin to implement a number of the strategies, particularly when there's a need for us to provide additional clarification and guidance around some of the mitigation efforts. Our school communities, I just want to emphasize, have been doing a remarkable job in mitigating the transmission of the virus, considering the continuous developments that have happened around COVID-19. We have been working with DOH, and Matt Stem and his team have been leading up some efforts on how we could better provide oversight on some of the mitigation strategies. So I'll pause here and allow Matt to sort of provide some highlights on some of the things that we've put in place to ensure that not only can we respond to inquiries that are coming from our school communities, but that we can make sure that we work with the schools to keep our schools safe.
Yep. So thank you. Very briefly, first of all, we commend our school districts. We've had 100% return on the attestation forms from our school districts that are in substantial counties. And what every one of those school districts is required to do is to post their attestations locally on their website. And we think that the first level of support and accountability comes at the local level, where community members can see what their districts have attested to. And then if there are any concerns that come regarding the implementation of what they've attested to, certainly the department is positioned in partnership with the Department of Health to follow up accordingly. But again, to this point, we've seen tremendous compliance from our school districts and strong leadership related to the commitments they've made vis-a-vis face coverings and what to do when they have positive cases in their buildings.
Thank you for your question. Now we have Mike Rubicam with AP Harrisburg. Mike, are you there?
Yep, thank you for holding this. I mean, a number of school districts, many school districts remain open for in-person learning, even though they're located, in a county where the Department of Health and the Department of Education would recommend that they're only instructing students virtually. Does that concern you? And are you communicating with these school districts those concerns and asking them to go virtual?
Sure. Mike, I appreciate the question. And we are constantly working with our school communities to make sure that we can ensure they create the safest learning environment. At the beginning, with my opening remarks, I did mention that there is no real one-size-fits-all strategy. What we've been doing is using research to make recommendations to schools in terms of the type of learning they should do, particularly if they find themselves insubstantial. I think, as Deputy Stem mentioned earlier, for those who are offering in person, they are having to attest to adhering to some of the mitigation efforts that have been put out by the Department of Health, particularly the face mask order. In addition to that, they also measure local transmission. So we put that in place to really double down on the importance of keeping the learning environment safe, particularly when they find themselves insubstantial. It's difficult to really assess whether or not every school should be following the same recommendation when they have a better understanding of some of the spread that's happening at their level. And that's why many folks are attesting to be able to adhere to some of these mitigation efforts to control the transmission of the virus. We are constantly offering them additional resources on how they can do things beyond the face coverings, as have been made clear by the guidance that we've put out. and continue to update around things coming from the CDC, right? Things that have to do with cleaning protocols, as well as personal hygiene, physical distancing, and other things that are important to couple with the face mask order. But we're doing everything to make sure that that learning environment can be safe for those students.
Thank you. And may I have one follow-up, please? Do you have any evidence, have you seen anything to indicate that schools in Pennsylvania have been significant vectors of transmission of the virus?
Sure. I just want to make sure that I'm not misinterpreting your question. Do we have evidence that illustrates whether or not the schools have been transmitters of the virus? Is that correct? I don't want to misinterpret.
That's correct. I mean, certainly schools have reported individual cases of the virus and have had to shut down periodically, but I'm wondering if you've seen widespread transmission in schools, if you've seen any evidence of that at all.
Sure. And so I just want to make a distinction, and then I'll invite my colleague Matt Stem as way to weigh in on any additional clarifications, but just make a distinction with regards to the role of the Department of Education and then the role of the Department of Health, because we have been collaborating on this effort. The Department of Health does work more closely with the school districts and all the communities around the Commonwealth to really track the transmission of the virus, get information through their either contact tracing efforts or case investigation efforts, often working with local public health officials as well. And so much of the tracking in terms of the transmission happens there. Where our role primarily comes in is ensuring that we have some clarification over the mitigation efforts that we're recommending for the schools, school districts to implement as well. And then we continue to sort of offer and troubleshoot these situational things that may emerge around that. Matt, I'm not sure if there's any more clarification to provide around mitigation at the local levels.
No, as we work with school districts, the most important thing to focus on is what to do when confirmed cases enter into buildings, whether it's with staff or students, and that's where we place our efforts on that mitigation.
Thanks for the question, Mike.
Thank you for your question. As a reminder, please ask only one question so we can move through a number of reporters today. Next up is John Finnerty with CNHI Harrisburg Bureau, followed by Amy Phillips-Haller with Pittsburgh KDKA Radio. John, please unmute. John, are you there? All right, Amy, we're gonna go to you. Amy, are you there? All right, Carrie Pauling with North Central PA. Carrie, are you there?
Yes, hi. I was wondering whether or not kids are going to have to change their masking practices at school. Now, are they going to have to wear masks all through lunch? The way the governor's orders were, it sounds like even during meals, that's a high transmission time. Are kids going to have to wear their masks even more often in schools?
Sure. Carrie, and I appreciate the questions, and this is particularly as it relates to face coverings and whether or not there are any exceptions, correct? So I'll work with this one with my colleague Matt as well, but I do want to make sure that we understand that the importance of the order is and it's changed over time. We've gone from recommended face coverings to mandates and orders where everyone must wear these at all times. And so there's been some shifts with regards to the importance, especially as we're learning more and more about the importance of face covering and mitigating the spread. I'll pivot to Matt to see if there are any exceptions that have been made, that schools have been made aware of through our guidance that we've shared.
Sure. Face covering requirements related to this order have not changed for schools. So schools have attested to the fact that they're going to adhere to the face covering requirement, which does allow them to take off their face coverings when they are eating.
Thank you for your question. Dominic Kuzalina with Altoona Mirror, followed by Sheehan Hargrove of Harrisburg WGAL TV. Dominic, are you there? Diane, are you there? Nicholas Matoni of Pittsburgh WTAE TV. Nicholas,
This is Bob Mayo with WTAE. I was assigned by Nick to be on the call. Can you hear me?
Bob, I can hear you very, not very
faint.
clearly. Yeah.
Okay, bear with me. Sorry about that. Switch something here. Hopefully this will fix it. In your dealings with school districts and also with parents in the community, can you point to any areas of more common misunderstanding or misapplication of practices that you've been addressing or that you would want to address that would clear up any either misgivings, misunderstandings, confusions or questions the public or individual districts may have? What are the more common areas and what is your addressing of them?
Sure. I'll give you some that are high level, and then I'll let Matt chime in with some that maybe come up in his local conversations. I think one of the areas where there's been some misunderstanding with regards to outcomes is in terms of some of the, I think the best way to frame these are competing demands that many of our school leaders have been facing, right? And these are outcomes associated with pressures to evaluate the success of, for example, mitigation strategies, right? Keeping the school safe. And then those that are more closely associated with learning outcomes as well. And I think if there's one area where we could work with our partners in the media and the various forms of communication is to really emphasize the need to be able to distinguish between those two elements, right? There are things that folks are doing now, the face covering orders, the other things tied with the CDC recommendations that are meant to improve the safety of the schools amid all the changes that are happening with regards to the transmission of the virus. And then there are things that we continue to work with them as a department. This is where we offer resources that have to do with lesson planning, pedagogical development, as well as resources that deal with the mental health and well-being of students that have different outcomes associated with them. And often these are two things that are in tension. And often we have to really unpack with families, communities, and then folks who are asking questions more in the public discourse. Matt, I'm not sure if there are other things that have presented themselves as areas that would need a little bit more clarification.
No, I don't have anything to add there. Thank you.
thank you for your question.
Just to clarify.
Dan
I was
McKenna
looking for
of
some-
Philadelphia 6ABC, followed by John Taylor of NBC 10. Dan? All right, John Taylor. Okay, next is Maddie Hanna with the Philadelphia Inquirer, followed by Sarah Hofias Hall with Scranton Times. Maddie, go ahead and unmute.
Hi, yes. I am wondering if you know how many schools have temporarily closed for some period of time due to the attestation order, as well as why the order only applies to public schools. I understand only public schools had to submit health and safety plans, but why did neither of those requirements apply to private schools?
Sure. Matt, do you want to take this one?
Sure. So to answer the first question, right now we have over half of schools that have entered into full remote instruction, but understand that those numbers do change on an ongoing basis, and that's not inclusive of individual schools that close due to confirmed cases in their building. So we know that a number of schools are in full remote instruction at this time. In response to private schools, just to clarify, private and parochial schools are included in the Secretary of Health's order around face coverings. So the face covering order does fully apply to private and parochial schools. And then when it comes to the attestation, PDE strongly encourages our private schools to adhere to the same commitments that our public schools have made in those attestations. And we do want to commend those private schools that have actually even submitted attestations to the state, demonstrating their due diligence. And so just wanted to make that clear.
Does the state have the authority to
One question,
require
please.
private schools?
Up next is Sarah Hofias Hall with Scranton Times, followed by Pat Crossley of Williamsport Sun-Gazette.
Good morning.
Sarah, are you there?
Yes, good morning. What is the status of PSSA testing? Does the state still plan to administer those tests this spring?
Sure. Matt, do you want to provide some clarification around the assessment question?
Sure. Right now, as of right now, the federal government is still requiring statewide assessments. In every state, there is not currently a waiver process available for statewide assessments. So Pennsylvania does plan, as of right now, to continue with our assessments. And the way we're doing that, cognizant of the current situation that we're in, is by extending our testing windows to hopefully allow sufficient time for more districts to return to in-person instruction to be able to administer the assessments in a safe way. We know that the other thing that we hope to do with the assessments, knowing the disruption in this year's data, is to be able to gather some opportunity to learn data in this process. And it's really important that we as a state gauge what's happening from an equity perspective with students that may be having more vulnerabilities in longer term remote learning. And so our hope also through the assessment system is to gather some of that information. We will watch what happens on a federal level and respond accordingly if there are any changes in the federal expectations around administering statewide assessments.
Thank you for your question. Pat Crossley with the Williamsport Sun-Gazette, followed by Joe Abramowitz of the Daily Courier. Pat, go ahead and unmute.
No question at this time.
Thank you very much. Joe, you're up next, followed by Melissa Dubbs with Philadelphia Fox 29. Joe? Melissa? Okay, up next will be Cynthia Fernandez with Spotlight PA, followed by Colleen Knudsen of WTAJ TV. Cynthia, go ahead and unmute.
Thank you. So my question is, what are the kinds of inequities that you're seeing and how do they relate to virtual learning or in-person learning? And how do school districts' ability to mitigate in-person learning, which I think everyone agrees is the best, related to how much funding they receive from the states? And one more question, are you concerned about next year's school budget?
Sure. So I think we'll tag team these because they're the bundle of questions, but I'll begin with the piece, Cynthia, about the inequities. And so clearly, when we began to work towards the mitigation and containment efforts around COVID-19, the obvious first step was to pivot away from in-person instruction to remote learning. In doing so, we create, of course, inequities in terms of people who can access learning, whether it's virtual or remote in a number of different ways. We did everything we could as a department to figure out how we might be able to provide additional resources to some of our programs, knowing that we were never going to be able to ensure that every single school had the resources needed for the pivot. We tried to provide support for our educators because there is the need to be able to provide them with the resources they need to be able to shift the learning modalities as well, in order to ensure that not just students can access the information, but that the information that was provided to them was being delivered in a way that ensured the same quality that we intend to ensure for everyone in their learning process. So there's that piece as well. You then get into an inequity with regards to resources available to do other things as well on the campus, which we've begun to really work closely with members of the General Assembly to figure out ways to address those, both at the state level and at the federal level. If you can recall, there were some stimulus funds that were provided to states, and the Department of Education worked closely with schools to make sure that we could distribute those in a way that was also alleviating some of the inequities that was in there. So a lot of this has to do with the continuity of learning and the ability for folks to be able to access that. We continue to do that moving forward. And then, of course, when you begin to read through the mitigation efforts that are recommended by the CDC, many of these, for example, if you have to create adaptations that require the development of screenings to protect folks, even creating classrooms or reconfiguring classrooms in ways that are safer, these are endeavors that would require resources that go beyond what schools had originally budgeted for. So these are things that really translate into inequities. But I also want to point out that these are things that, while COVID has exacerbated the inequities, have been things that the department has been working to address, historically as well with distributions. Matt, I'm not sure if there's anything else we should include in that conversation.
Mhm. Thank you. I would just say that one of the greatest challenges that not only Pennsylvania, but the entire country and the world are facing right now is the disproportionate impact that COVID-19 pandemic is having on particular communities. And we are certainly seeing that in Pennsylvania. One of the things that our team has done in response to that has been to work very closely with the field and with our intermediate units in providing direct support and resources. Number one, on the pedagogy of distance learning and how to ensure access and engagement for all students. And then more specifically, we have a partnership with PBS Public Television, and we are piloting in a number of districts around the state, in partnership with our intermediate units, a way to data cast digital content to students that may not have internet access. And so we will continue to leverage all of the resources that we have to meet those needs that we know exist.
Thank you for your question. Colleen Knudsen with WTAJ-TV, go ahead and unmute.
Good morning. Thank you so much for hosting this press conference. My question is mainly about student mental health. The governor's order put a stop to extracurricular activities, including sports and music. But a lot of times this is a way that students can let go of some of that stress. And with schedules constantly changing, virtual to hybrid to completely back in person to back to remote, what are some conversations that school districts can have with students and parents to try to alleviate some of that stress?
Sure, Colleen, I appreciate the question. And I'll start with sort of just a quick clarification, and I'll ask Matt to also share some of the resources that have been developed by his team to address specifically mental health and well-being of students. So the governor's current order is a temporary halt, right? And so I just want to make sure that that's not lost in the conversation. This is a temporary halt in the effort to be able to mitigate some of the transmission that has been happening at unprecedented levels in the past several weeks. And so one of the things that we want to make sure that that's not lost in the conversation. And then there's a lot of emphasis that we've begun to place, not just on mental health and well-being, Colleen, of the students, but also concerns that have emerged now to think about what that means for our educators, our school leaders as well, right? Because this is a broader, now that we're entering month number 9, this is a broader discussion. And Deputy Stem and his team has really been working to disseminate a number of these resources out there in the public. I'm not sure, Matt, if there's a few you may want to highlight around this or direct folks to a place where they could find these resources.
Thank you. Yes. And thank you for the question and acknowledging the reality that many of our students and our staff as well in schools and parents have had an emotional impact through the pandemic over the past 9 months. We have on our website resources in that regard. We have a staff and student wellness guide, and we are one of a handful of states that has actually included resources not only for focusing on student social emotional well-being, but also staff emotional well-being through the pandemic. And so we would encourage individuals to look at those resources.
Thank you for your question. Mark Sims with Radio PA is up next, followed by Ron Southwick with Penn Live. Mark, go ahead. Ron Southwick, are you there?
Yes, I'm here. Can you hear me?
Yes, sir. Ask your question.
Thank you. Good morning. I just wanted to get a little clarity because I know you've said that there's not a one-size-fits-all approach, but at the same time, at what point does the spread get so bad that there has to be a statewide approach to put a pause on in-person learning? Because 66 of 67 counties have substantial spread. Secretary Levine said the rise in school-age children is alarming. So if we're not at that point now, which seems pretty bad, at what point do you have to pull the trigger and say there does need to be a one-size-fits-all approach and there needs to be a statewide pause on face-to-face instruction?
Sure. And I appreciate that. And I think at the beginning, I had mentioned that we have moved from sort of segmented approaches to targeted approaches to now figuring out where there's areas where we could do statewide interventions to help with the mitigation and spread of the virus. I want to just preface these comments by saying we work very closely with the Department of Health and the administration to ensure that we could take the best approach where we have continuity of learning that happens, particularly in places where there could be in person. The governor and the Secretary Levine, of course, always have the discretion over how they're going to take more aggressive mitigation efforts at the state. But at the moment, because of our ability to be able to integrate emerging research, new findings around the mitigation strategies, we've been able to stay the course with regards to allowing for schools at the local level to make sort of the decision on whether or not they would follow the recommendations of the department. Matt, I know that your team has been working on sort of researching where we go next from here, because as you can tell, the matrix that has recommendations for the various schools on the type of learning models that should implement has the ability for them to pivot on those learning or the provision of that learning based on the local transmission. And so we continue to place emphasis on that particular element, right? Understanding that that varies from place to place. But there are also probably additional steps that we continue to explore on what happens next, particularly since we're going to find ourselves in this environment for at least a few more months, if not longer. And then we're beginning to figure out how the current mitigation efforts are going to interact with whatever comes next in terms of us moving more closer to vaccination and other things. Matt, I'm not sure if there's anything that you want to add with regards to the forward-looking part of this.
I would just add that the question is an excellent one, and it's one that I think every leader around the world is trying to answer right now, which is what is the threshold at which point linked transmission in schools, becomes, where in-person instruction is no longer tenable. We're watching carefully the research right now. There's a study happening in France where they're bringing in elementary students and excluding middle and high school students and collecting some broad scale data on what the impact is going to be on transmission in those communities. So we're watching what's happening here at a regional, national, and global level, and we will use those results to inform our next steps.
Thank you for your question. We have time for one more question with David Meekiel of Reading Eagle. Go ahead and unmute and ask your question.
Yes, hi, thanks for taking the time. You kind of touched on this a little bit earlier, but with the application forms and all of the other mitigation efforts and orders, what specific enforcement tools do you have if schools aren't complying with what they have said they're going to comply with? What specifically can you do to kind of force districts' hand?
Sure. And I'll let Deputy Stem answer a part of the question as well. But I just want to make sure that it's emphasized that this is a collective effort across various agencies, from both developing the mitigation efforts, but also sharing in the area of enforcement. So it comes in a number of different manners. Deputy Stem has been working with regards to at least finding ways to get a finger on the pulse of how things are moving with regards to the various school districts. So as things emerge locally, how then can we stay ahead of that to be mindful of making sure that folks are doing their best to adhere to what's been put out as mitigation efforts, but also to ensure the safety of the students. Matt, anything we want to add in terms of enforcement measures that have currently been announced by our agency?
Sure. The first level of enforcement is maintaining close communication with what's happening in schools, and particularly making sure that local communities know what is happening in schools. So again, the first layer of enforcement is the requirement that all districts post their attestation documents onto their websites as part of their health and safety plans. And then additionally, if any calls come in through the Department of Health with concerns about what's happening in local school districts, the Department of Education does have a complaint system in place along with the Department of Health, and we will investigate and look into those cases accordingly, and then leverage the appropriate next steps vis-a-vis either the Department of Education or potentially the Department of Health. But to this point in time, overwhelmingly what we've seen is thoughtful leadership among our school district leaders, among our school boards and our local communities. And where there are exceptions to that, both the Department of Education and Department of Health will respond fully and accordingly.
Thank you for your time today. This concludes today's press conference. Thank you for participating. Commonwealth Media Services will be sending a PA cast with a link to the video of this press conference shortly. Thank you again and have a good day.
Thank you.